Welcome, everyone. Thank you for coming. I'm Aaron Hale with Hale Financial Group. And over the next 45 minutes or so, we're going to talk about some of the things you need to know about healthcare when planning your retirement. We're going to cover a lot of information. If nothing else, I hope you come away from this presentation understanding 3 key points. The first key point is that if you do not enroll in Medicare on time, you will pay a monthly penalty. A lot of baby boomers don't know if or when they are supposed to enroll in Medicare, but there are very clear rules about when you have to sign up. And if you don't sign up within a specified window, you will be assessed a monthly penalty that you'll have to pay for the rest of your life. The second key point is that if you do not get the right insurance to go with your Medicare, you may pay too much in premiums and out-of-pocket costs. Now, the fact that you even need private insurance to go with Medicare is a surprise to many people. Some people think that Medicare covers everything. But no, in order to have prescription drug coverage and coverage for other out-of-pocket expenses, you need to have private insurance, and we'll show you how that works. The third key point is that if you do not plan for higher healthcare costs in retirement, you could run out of money or not be able to get the care you need. And people are usually happy to go on to Medicare when they turn 65. Because it provides some relief against high health insurance premiums. But you must be prepared to factor higher future healthcare costs into your retirement budget. And the best time to do this is now. You'll see what I mean a little later in the program. The presentation today will be divided into 3 parts. In part 1, we'll be talking about Medicare. What is it? Who needs to enroll in Medicare and when? And how do you enroll in Medicare? In part 2, we'll be discussing the private insurance that goes with Medicare. To understand the public-private partnership that is Medicare, we'll be talking about how much Medicare costs, what it covers, more importantly, what it doesn't cover, and how private insurance integrates with Medicare. And in the third part, we'll talk about how to plan for higher healthcare costs in retirement. There are 2 reasons why our healthcare expenses will be higher in the future. One reason is inflation. The other is the increased need for healthcare services as we age. One expense that needs to be planned for is long-term care. Some of you may have had experience with a parent or other relative needing help with activities of daily living such as bathing and dressing or even just keeping up with housework and preparing meals. Many people are surprised to find out that the cost of these services are not covered by Medicare. Okay, let's start this education session by talking about Medicare enrollment. So who pays for health care in the United States today? Well, if you're under 65, your health insurance is usually work-based. If you're still working, your employer probably provides health insurance. If you're retired, you might have a retiree plan. Or maybe you've recently left your job and have extended your employer coverage at your own expense under COBRA. Maybe you've purchased your own individual health insurance policy. After age 65, Medicare generally pays first. That is, our health insurance system is set up so that once a person becomes eligible for Medicare at 65, most private insurance becomes secondary to Medicare. So when you incur a healthcare expense, the bill is submitted first to Medicare, and after Medicare pays what it's going to pay, any other insurance you have may pay some or all of the rest. The only exception is employer group plans that cover 20 or more employees. So if you're still working and covered by such a plan, or if you're covered as a spouse under such a plan, your employer plan will pay first. And this has implications for enrollment, as we'll see in a minute. What this means is that if you are covered by an employer group plan that covers 20 or more employees, you must enroll in Medicare when you turn 65. What if you don't enroll in Medicare on time? Well, the consequences are pretty dire. First, you'll be charged a late enrollment penalty, and the longer you go without enrolling, the higher the penalty will be, and it will continue for the rest of your life. The second consequence is that your healthcare expenses may not be covered by insurance. As I mentioned, Medicare is the primary payer in most circumstances. If you have other insurance, it will not pay its share until Medicare pays its share. So if you don't have Medicare, you could end up getting stuck for the whole bill. And finally, your private insurance options may be limited if you're in poor health or have a pre-existing condition. The private insurers that coordinate with Medicare have to take you if you sign up for Medicare during your enrollment period. But if you don't, and you go to apply for private insurance later, you may not be able to get the insurance, or you may be charged a higher premium. Okay, let's back up a bit and ask, what is Medicare? Well, it's a national health insurance program for people over 65. It was signed into law in 1965 by President Johnson. It's administered by the Centers for Medicare and Medicaid Services, and enrollment is handled through the Social Security Administration. Everyone over 65 is eligible for Medicare. This includes all U.S. citizens and legal residents who have lived in the U.S. continuously for at least 5 years. Some people under 65 can get Medicare if they receive Social Security disability benefits. Our discussion today will pertain to the first group, and that's people that are over 65. Medicare is divided into 4 parts. So Part A covers part of the cost of hospitalizations. Part B covers part of the cost of medical services, such as a doctor visit, a procedure, a diagnostic test. The bills for Part A and B are paid by Medicare. Parts C and D are where the private insurance comes in. Part C is an alternative way to get Medicare. You can sign up for a Medicare Advantage plan offered by a private insurer and get all your services under Part A and B, and usually prescription drug coverage as well through the plan. Instead of Medicare paying for your hospital and doctor bills, it pays the insurance company, offering the Medicare Advantage plan a flat payment for each enrollee, and then the plan is responsible for managing and coordinating your care. Part D is prescription drug coverage. It is offered by private insurers who contract with Medicare. Each prescription drug plan is slightly different, which is why you'll want to shop carefully for your drug plan. That's something we help our clients out with. Even if you don't take any prescription drugs, when you first go on to Medicare, you'll want to sign up for a Part D drug plan, because if you go without drug coverage for very long, you'll face a penalty when you finally do enroll. This image comes from the Medicare and You booklet. It shows that there are 2 ways to have Medicare. If you go with original Medicare, you sign up for Part A and B. Then you decide if you want prescription drug coverage under Part D. This shows drug coverage is optional, but it can be dangerous to go without drug coverage, so we are recommending that everyone plan to have some kind of prescription drug coverage starting from the outset of Medicare. In Step 3, you decide if you want supplemental coverage. Again, Medicare shows this optional, but we think it's pretty important because Medicare leaves too many gaps, and we'll talk more about this in a minute. The second way to get Medicare is through a Medicare Advantage plan offered by a private insurance company. There are many companies in this area offering Medicare Advantage plans. So if you want to go this route, it'll be important to shop for plans and find one that meets your needs. And again, drug coverage is shown as optional, but we would recommend that you choose a Medicare Advantage plan that offers prescription drug coverage. If you are receiving Social Security when you turn 65, you will automatically be enrolled in Parts A and B. And if you're working and covered by an employer group plan, you may not want Part B. In that case, you can decline it. Otherwise, you'll go ahead and accept Medicare Parts A and B, and your coverage will start on the first day of the month you turn 65. Parts C and D are not automatic. If you want a Medicare Advantage plan, you can contact us and we'll help you sign up for one through them. Or if you want to stay on original Medicare and have a standalone Part D prescription drug plan, we'll help you shop out which insurance company's plan you'll want to go with so you can save the most money, and we'll enroll you in that. And you should do this at the same time you enroll in Part A and Part B, which is before your 65th birthday. So what if you're not receiving Social Security when you turn 65? More and more people are continuing to work, or at least delaying the start of Social Security in order to receive a higher benefit. And in this case, you'll need to proactively enroll in Medicare during a Medicare enrollment period. There are three main Medicare enrollment periods. The initial enrollment period applies if you are not covered by a group plan that covers 20 or more employees when you turn 65. If you are covered by an employer group plan because you or your spouse is still working, you have a special enrollment period, which I'll explain in a moment. If you miss either one of these enrollment periods, you can sign up for Medicare during the general enrollment period. The initial enrollment period for people who aren't covered by a group plan at 65 starts 3 months before you turn 65 and lasts until 3 months after you turn 65. But although it lasts a total of 7 months, you should really plan to enroll in Medicare during the 3-month period before you turn 65. Then your Medicare coverage will start on the first day of the month you turn 65. And by the way, if your birthday happens to be on the first day of the month, everything is moved up a month. So just pretend your birthday is in the previous month. So for example, if your birthday is June 1st, your initial enrollment period would start February 1st. If you sign up during February, March, or April, your coverage would start May 1st. We've been talking about signing up for Medicare as a whole, but there are times when we need to break it into parts. Most people will sign up for everything all at once, but there may be times when you'll want to sign up for some parts and not others. If you are still working when you turn 65, check with your benefits administrator to see if you should sign up for Part A or give me a call. I'm happy to walk you through it. We mentioned earlier that if you are covered by an employer group plan when you turn 65, you have a special enrollment period that comes later. However, you may want to sign up for Part A when you first become eligible for it at 65. The reason is that it may offer better coverage for hospitalization than your employer group plan. And Part A is usually free to you, but check with your benefits administrator anyway. If your employer group plan is a high deductible health plan paired with a health savings account, and if you want to keep contributing to the health savings account, you should not sign up for Part A. The reason is that once you enroll in Medicare, your HSA contributions must stop. But let me be clear, if you have an HSA and your employer plan covers fewer than 20 employees, you will have to drop the HSA and sign up for Medicare during your initial enrollment period at 65. If you are not covered by an employer group plan when you turn 65, you will want to sign up for Part B during your initial enrollment period, preferably that 3-month period before you turn your 65th birthday. So if you're not working, if you're self-employed, if you're employed by a company that has fewer than 20 employees, if you're on COBRA, even if you're receiving retiree health benefits, you'll want to sign up for Parts A and B during your initial enrollment period. If you signed up for Parts A and B during your initial enrollment period, and if you think you will ever in your life want prescription drug coverage, you should enroll in Part D at the same time. If you go more than 63 days without credible prescription drug coverage, you will pay a late enrollment penalty when you finally do sign up for Part D. So it's better just to go ahead and get your drug coverage from the outset, even if you aren't currently taking any prescription drugs. And as mentioned before, you have two options. You can enroll in a standalone prescription drug plan if you have original Medicare, or you can get your drug coverage through a Medicare Advantage plan. Okay. That takes care of the initial enrollment period. Now we're going to talk about the special enrollment period. And this is for people who were covered by an employer group plan that covers 20 or more employees when they turn 65. In this case, you will not be penalized for not enrolling in Medicare at 65, but you will be penalized if you don't sign up during your special enrollment period. And the best time to sign up is before your current coverage ends. That way you'll have no gaps in coverage. But you actually have a grace period of several months to avoid late enrollment penalties For Part B, that grace period starts the month your coverage ends and lasts for 8 months. For Part D, it's only 63 days. To summarize, you can avoid late enrollment penalties by signing up for Medicare during your initial or your special enrollment period, but to avoid gaps in coverage, which is even more important, you should sign up before your current coverage ends. So what if nobody ever told you about the Medicare enrollment periods and you didn't sign up when you were supposed to? Well, you can still sign up, but now you have to do it during Medicare's general enrollment period, which runs from January 1st through March 31st of each year. This is the only time you can sign up for Medicare if you are outside of your initial or special enrollment period. Coverage starts July 1, so as you can see, this could leave you with some coverage gaps, so you really want to avoid having to sign up during the general enrollment period, but it may be the only option for some people. The important thing to know is that you just can't sign up for Medicare as soon as you realize you failed to do so. If you're outside the general enrollment period, you have to wait until the next one rolls around. Okay, let's do a quick review of Medicare enrollment periods because this is important. The initial enrollment period is for everyone age 65 who is not covered by an employer group plan that covers 20 or more employees. The best time to sign up is the 3 months before your 65th birthday, and Medicare coverage will start on the first of the month you turn 65. The special enrollment period is for everyone over 65 who is covered as a current worker or a spouse of a current worker under an employer group plan that covers 20 or more employees. The best time to enroll in Medicare is before that coverage ends. Then your Medicare coverage will start on the first of the month of the enrollment. The general enrollment period is for people who did not attend this presentation and didn't know they needed to sign up for Medicare during their initial or special enrollment periods. They can sign up between January 1 and March 31 of each year with coverage starting July 1st. So how do you sign up for Part A and B? It's very easy, and as I mentioned, if you're already receiving Social Security when you turn 65, you'll be automatically enrolled in Medicare. If not, you can go to ssa.gov, click on Medicare, click on the big Apply for Medicare Benefits button, or you can do it by phone by calling Social Security at 800-772-1213. Part D isn't quite as straightforward because first you have to decide how you want your prescription drug coverage, whether you want a standalone prescription drug plan or a Medicare Advantage plan. In either case, you'll be shopping for plans offered by private insurers. And once you've decided on original Medicare versus Medicare Advantage and then chosen a specific plan, you can enroll in Part D through the insurance company or through Medicare, but this is something we just help our clients do. And this brings us to Part 2, Medicare and private insurance. So this pie chart shows the breakdown of spending by the average Medicare beneficiary for premiums and services. And almost half of spending, or $2,605, is for insurance premiums, while about 51%, or $2,763, is spent on services, including long-term care. Total out-of-pocket spending by the average Medicare beneficiary is about $5,368. These figures are for 2011, which is the latest data we have available. So focusing on the out-of-pocket costs paid by Medicare beneficiaries, they fall into two main categories: premiums and out-of-pocket costs. Monthly premiums are paid to Medicare and to the private insurance companies offering the drug plans and Medigap policies or the Medicare Advantage plan. Out-of-pocket costs include deductibles, the portion of doctor bills not paid by Medicare, and the services not covered by Medicare. First, let's look at monthly premiums. Part A is free if you or your spouse has paid into Medicare over 10 years. This is one reason most people sign up for Part A when they turn 65, even if they're covered by an employer group plan. Doesn't cost anything. Part B is different. It cost $134 per month in 2017. If you were held harmless from having your Social Security check go down as a result of the very meager Social Security cost of a living adjustment, your Medicare premium increase is limited to your cost of living adjustment. In other words, you will pay the same amount as last year plus the amount of your COLA. The Part D premium is adjusted for inflation, so it might be higher next year. Also, higher income beneficiaries will pay more. The Part B premium is paid to Medicare. Part D premiums vary depending on the plan you choose. The Part D premium is paid to the private insurance company whose drug plan you choose. This table shows the Part B and D premiums for the different income levels. So if you're single and your income is under $85,000, or if you're married and your income is under $170,000, you will pay regular Part B premium of $134 per month, unless you're held harmless. There will be no income-related adjustment. Your Part D premium will vary, but if you pick a plan that charges the average premium, you'll pay about $40 per month for a total of $174 per month for Part B and D coverage. If your income falls into one of these other tiers, you will pay an income-related adjustment on top of the base premium. For example, if you're in the second tier, you'll pay an extra $53.50 for Part B and $13.30 for Part D on top of your regular premiums. And this will bring your total up to $240.80 per month. Keep in mind that these are per person, so if you're a couple, you can double these amounts. Your tax return from 2 years ago is used to determine this income-related adjustment. For example, the adjustment for 2017 will be based on the income reported on your 2015 tax return. And keep in mind that the premiums shown here do not include premiums for Medicare Advantage or Medicare Supplement plans. This is for Part B and Part D only. So in addition to premiums, there will be some other out-of-pocket costs under Medicare. If you have to be hospitalized, the first $1,316 in hospital costs will come out of your own pocket before Medicare starts paying. Some private insurance plans cover this, as we'll see in a minute. The Part B deductible is a reasonable $183 per year, and this is waived for some preventive services such as flu shots and certain screenings. The Part D deductible is $400 per year under the standard Medicare design, but Part D coverage is quite complicated, as we'll see in a minute. After you've met your deductibles, there are some other costs. Medicare doesn't pay your entire medical bill. If your hospital stay exceeds 60 days, you'll be responsible for $329 per day up to the 90th day, and then $658 per day up to the 150th day. And after that, you'll pay the full cost. Medicare pays the full cost of 20 days of skilled nursing care. And after that, you'll pay $164.50 per day for days 21 through 100. And if you need more than 100 days of skilled nursing, you'll pay the full cost. As for Part B, your responsibility is 20% of the Medicare-approved costs. Doctors who accept assignment agree to be paid directly by Medicare and will not bill you any more than the Medicare-approved amount. Doctors who don't accept assignment may charge more. If they don't charge more than 15% over the approved amount, Medicare will pay 80% of the Medicare approved amount, and you'll be responsible for the rest, the 20% plus the 15% over. Part D is complicated. We could spend all of our time talking about it if we wanted to, but we don't. The main thing to understand is that there are cost-sharing arrangements under Part D, no matter which prescription drug plan you choose. So there are 4 levels. First is the annual deductible of $400. Next is the initial coverage period, which the drug plan pays 75% and you pay 25% of covered drugs. And after total drug costs have exceeded $3,700, you get into the donut hole. And here you'll pay 40% of covered brand name drugs, 51% of covered generic drugs, and 100% of the rest. And once your out-of-pocket spending for drugs reaches $4,950 in 1 year, the insurance kicks in again and you'll pay little or nothing for your drugs. Please keep in mind that this is the basic Medicare model. Some drug plans offer more coverage, and they offer different coverage for different drugs, and that's why you have to shop very carefully for drug plans based on the medications you take. After looking at all of those out-of-pocket costs that you have to pay, you might be wondering what Medicare does cover. Well, it covers the first 60 days of hospitalization, minus the deductible, of course. It covers 80% of your doctor bills, and it covers some preventive services. The best reference for finding out what Medicare covers is the Medicare and You book. To get it, you can call 1-800-663-4227 or go to medicare.gov. The Medicare and You booklet spends over 20 pages talking about what Medicare covers, and only one page talking about what it doesn't cover. I'm not talking about partial payments. I'm talking about no coverage whatsoever for the list of services you see here. Now, some of these things you can avoid. Cosmetic surgery is optional, for example. And if you never go outside the United States, you don't have to worry about that. But some of these other things may be necessary. Dental work, eyeglasses, hearing aids. And these are things you'll have to cover yourself. This is where private insurance comes into play. Private insurance can cover all or part of your deductibles, those hospital costs after 60 days, and the 20% of doctor's bills that Medicare doesn't pay. And of course, all prescription drug coverage is offered through private insurers who contract with Medicare. Medicare alone doesn't cover them. Depending on the drug plan you choose, it may cover the deductible, and it should cover most of the cost of certain drugs during the initial benefit period and the catastrophic coverage period, but it won't cover all drugs. Each plan has its own list of drugs called a formulary, and it won't cover much, if anything, in the donut hole. Medicare supplement insurance, commonly called Medigap policies, are issued by private insurance companies and are designed to fill in the gaps that Medicare doesn't cover. And although they are not affiliated with Medicare, they do have to follow certain federal and state laws designed to protect you. Medigap insurance policies are standardized. They're identified by the letters A through N. So if you buy a Plan F in California, it will offer the same benefits as a Plan F in New York or Arizona. However, the premiums can vary considerably from company to company and from area to area. So for example, in one Florida county, the monthly premiums for Plan F range from $192 to $465 per month for the exact same policy. That's why it's so important for you to carefully evaluate Medigap insurance and not pay too much for it. This table shows the various benefits for the various plans. And this is in the Medicare and You booklet, so you don't have to memorize it. The main thing to remember is that when you are looking at a particular plan, it will be the same as every other plan offered by other insurance companies. So you'll want to make sure you don't overpay for the same policy you can get elsewhere for less. Medicare Advantage plans, also called Part C, are offered through private insurance companies that contract with Medicare. Medicare pays an amount to the plan for each member's care, and the plan is responsible for providing the care. You may have to use the network's doctors or hospitals. You'll want a plan that includes prescription drug coverage. You may even want to be able to get extra benefits like vision care, but the benefits and cost sharing for Medicare Advantage plans are different than for original Medicare. So again, you'll need to shop carefully and choose a plan that fits your needs. And this is just a reminder, once again, to shop carefully for private insurance. Medigap policies are standardized, but the premiums vary considerably. First, choose a plan that offers the coverage you need. Plan F is the most comprehensive plan. Drug plan benefits vary considerably. If you don't take any prescription drugs at present, you can choose the cheapest plan available. You can always switch to a more comprehensive plan down the road. If you don't take prescription drugs, you'll want to examine each plan's. If you do, you'll want to, make sure you get the one that gets the coverage that provide for the medicines you take. And same for Medicare Advantage plans. Evaluate each plan's offering and costs and make a clear choice about which private insurance to go with. And now we come to part 3. We're just planning for higher healthcare costs in retirement. Here's a look at healthcare spending by gender and by age group. Women tend to spend more than men on healthcare. And older people spend more than younger people. A large part of these higher expenses later in life are for long-term care. And here's what a typical Medicare budget might look like today, considering premiums only, if you are not subject to the surcharge. The Part B premium is $134. The Medigap Plan F premium is about $200, and the Part D drug premium is $40 for a total of $374 per month. Considering both premiums and out-of-pocket costs, the typical healthy Medicare beneficiary might spend nearly $6,000 per year in premiums, non-covered prescription drugs, and other out-of-pocket costs for dental, vision, and alternative care. What can cause your healthcare budget to change? Well, 2 things: inflation and the possibility of getting sick. As healthcare costs continue to rise, insurance premiums go up, and the non-covered services that you pay for yourself get more expensive. If you get sick, you may need more expensive prescription drugs and have to spend so much that you find yourself in the donut hole, having to pay many thousands of dollars a year for your medications. And there's always the possibility as you age, you'll require more non-covered services like major dental work, hearing aids, or long-term care. How can you plan for rising healthcare costs when you might be on a fixed income when you retire? Well, one way is to set aside enough funds to cover your future healthcare costs before you retire. Fidelity does a study every year to determine how much the average couple might need at the start of retirement to fund all their future healthcare costs, not including long-term care. They say the average couple will need about $260,000. The Employee Benefit Research Institute did a similar study with slightly different variables and came up with $124,000 for men, $152,000 for women, and $259,000 for couples. But these are just averages. If you live longer than the average life expectancy, or if you have different healthcare needs, you might need more. And remember, these amounts do not include long-term care. So how many of you know someone who got old and needed long-term care? We're not necessarily talking about nursing home care. Long-term care can range from someone coming to a home for a few hours a week to help with meal preparation, all the way up to skilled nursing care. The important thing to know is that Medicare and Medigap do not cover long-term care. The most comprehensive Medigap policy pays for 100 days of skilled nursing care only. But if you're not sick enough for skilled nursing care, they're not going to pay for it. The average period of skilled nursing care is just 28 days, and when it comes to custodial care for help with activities of daily living, there is no coverage at all. And before you say, well, I'll never get old and need help, consider this. 42% of Medicare enrollees have activity limitations. Some of them need help with so-called instrumental activities of daily living, which includes things like shopping and cooking, and others need help with things like bathing and dressing. And here we see the causes of activity limitations. At every age level, the most common cause is arthritis, followed by heart problems, and these become worse with age. Senility or dementia has a relatively low occurrence for the 65 to 74 age group, but it becomes more prevalent as people live into their 80s and 90s. And when you're healthy and active in your 60s, it's hard to imagine not being able to bathe or dress yourself, but it's just a fact of life that people need help as they get older. And nearly half of all people over 85 have some difficulty walking, and this in itself can limit the things you can do for yourself. For most people, the need for long-term care is very gradual. You start out needing help with shopping, preparing meals, doing housework, managing money, and traveling. And this level of care is often provided by a family member or a paid housekeeper. And then you get to where you have difficulty with these essential activities of daily living: eating, bathing, dressing, going to the bathroom, transferring from a chair to a bed, and maintaining continence. I know nobody likes to think about these things, but we all know of people who have needed custodial care. This third level of care is skilled nursing care, and this is care provided by a licensed nurse for a medical condition or rehabilitation. Sometimes this level of care is short-term, and if you need it for 100 days or less, Medicare and Medigap might pay for it, depending on which Medigap policy you have. But sometimes skilled nursing care is needed for a longer period of time, and then the cost can become burdensome. How much does long-term care cost? Well, it varies with the type of care, of course. The Genworth annual cost of care survey shows us the median costs across the United States. Homemaker services range from $9 to $34 per hour. The median is $20. Home health aides charge a bit more, ranging from $10 to $34 and averaging $20. When estimating this lower level of care, you might assume something like 8 hours a week at a cost of $20 per hour, which would be $160 a week or about $700 a month. 2 years of this type of care would cost about $17,000, not including inflation. Adult daycare costs about $68 per day on average. However, it can range from $15 to $160 per day. Residents in an assisted living facility can range from $674 to $9,400 per month, depending on location and amenities. The median monthly rate is $3,628 per month. 2 years of this type of care, not including inflation, would be over $80,000. The most expensive type of care, of course, is in a nursing home where residents can get skilled nursing care. A private room ranges from $89 per day to $826 per day. The median daily rate is $253 per day, and the median annual rate is over $90,000. None of us want to think about getting old and needing long-term care, but there are some very compelling reasons why we need to. One is to spare your kids and other family members the burden of taking care of you. They may not mind doing your shopping or paying your bills, but if you were to need constant supervision or help with bathing and dressing, that's beyond the call of duty for even the most devoted son or daughter. Another reason to plan for long-term care is to avoid having to spend down assets in order to qualify for Medicaid. This state-run welfare program will pay for your care if you don't have any money, but that's the point. You have to spend down assets to less than $2,000 in order to qualify, essentially leaving yourself destitute. People on Medicaid don't have a lot of choices about the kind of care they receive, and this is another reason to plan for your own long-term care. To be able to direct your own care and obtain the kind and quality of care that you want. When you're paying for it out of funds you've set aside for this purpose, or when you have insurance that is paying for it, you can decide how you'll be cared for, whether it's in your own home or an assisted living facility of your choosing. There's a lot more to say about planning for long-term care, but our time is nearly up, so I will leave you with 3 reminders that relate back to the 3 key points I talked about at the beginning of this presentation. Reminder number 1 is to enroll in Medicare on time. Know which enrollment period applies to you, whether you need to sign up at 65 or can wait until your employer group coverage ends, and enroll when you need to in order to avoid penalties and coverage gaps. Reminder number 2 is to shop carefully for private insurance to go with Medicare. Evaluate all your options and choose the drug plan, Medigap policy, or Medicare Advantage plan that offers the coverage you need at a price you can afford. Don't be one of these people who pay too much for private insurance because they didn't know any better. And finally, plan now for higher healthcare costs in retirement. We know healthcare expenses will be higher than they are today, so when you're planning your retirement and figuring out how much savings you'll need to make your money last, be sure to factor in an extra amount for healthcare. You'll be very glad you did. Okay, this concludes our presentation for today. Thank you for your attention. Again, my name is Aaron Hale, Hale Financial Group. If anybody would like to speak to me or have questions, please give us a call at 480-771-4035 or email me at aaron@halefinancial.com, and you can always visit our website for more information at halefinancial.com. Thank you so much and have a great day.